The second sequence course in health education was Health Ed 430, which had to do with community health theory. And so this was more of when you approach a problem, what kind of theory would you use? And it was a semester-long course of writing a 20-page paper on a problem, you know. And so you would go through these different theories: political economy, liberation education, diffusion of innovation, social marketing, social support theory, social cognitive theory, health behavior models, stages of change. And in health education, everything is based on the ecological model of health. And so when you think of people and what their barriers are, so for instance, like a low-income community, you would think, okay, at the individual level, what influences them? And then at the interpersonal, you know, the people around them, family members and friends and neighbors, and then community, what resources and you know, churches, institutions, and stuff like that, are churches and services and cultural norms and social norms in that community. Then of course organizational, institutional, such as, you know, businesses and schools and hospitals. You know, a lot of low income places don't have access to those facilities. And then finally it's public policy. You know, so if you know, it's always a hot debate, but if a state government passes law against, you know, discriminating people, as in would be with gay marriage, and then how does that affect everything else? And of course, everything affects each other. The factors influence each other. So it was a very interesting thing to understand this, but then to figure out what would be the best way to address it with your theory. So our 20-page paper was, we have to choose a population that's having issues, and then we would have to figure out what policy or what theory would be best to help that problem be addressed. And so that was very difficult as well, because like I said, the 20-page paper and writing all the constructs of each theory and going through the ecological model on different aspects was very, very long. But again, it's definitely an eye-opener, and it makes you understand and think differently, and gives you that different perspective. So this, again, like I said, this is the sequenced required course for health education / public health.